Hi, I'm Connie Gould. I was the patient advocate in the design team to bring this place to life.
When Prairie North Health Region decided to build a new primary health clinic in Lloydminster, Saskatchewan, it committed to using a design process grounded in lean philosophies. The approach was called a 3P, production preparation process, and the idea was to build a new clinic environment that would allow patients, family, care providers, information, supplies, and equipment to all flow seamlessly to create the best possible patient experience. In October of 2013, 25 team members worked together for 4 days to create the clinic vision, layout, must-haves, and can't-haves. Physicians, nurses, counselors, office staff, therapists, dietitians, administration, and board members were represented on the team. Key to it all, though, was the voice of the patient advocate.
Well, it was my doctor. They were each to get so many patients. So she asked me if I would like to come forward and help with the design. And at first I said, oh yeah, sure. Then when they told us what we had to do, I was a little unsure. I'm thinking, I'm not an engineer. I don't know what I can put in, but everybody had their ideas and they just rolled all together and it went really smooth. I'm really happy with it. So the patient would be shown into the room here. So then once you're in the room, the patient takes a seat over here on the chair. The door is closed and the doctor would enter through the back door here. So, and as you see, they've got their examining table. They've got their supply cupboards in here, which are stocked from the outside so that there's no interruption with the doctor or patient. I like that. Same with the garbage. There's a garbage in every room, so it's tucked away out of sight, and then they can pull it out, from the other side. They don't have to drag it through the room. There's the computer station the doctor has to be with the patient, the sink for washing up, and like I said, the doctor goes in and out of this door here.
My name is Sharif Takla and I'm a family physician in Prairie North Health Center. I think the benefit for the patients to be seen faster. There's a main concern for all the patients not to wait in the waiting area for 1 or 2 hours. And the second is the efficiency of being seen in a well-equipped clinic. And we have a procedure room too, that if the patient needs any procedure or minor surgery, we can do it the same thing.
So this leads to the doctor's area. These are the workstations for the doctors and is it the nurses that are here? And whatever staff may need to be at the station.
I'm Shanda McDonald. I'm clinic assist at the Prairie North Health Center. We have 7 doctors in total, 3 new. Each doctor has 2 exam rooms. So there is much more space. It's a beautiful, beautiful setup. It's more organized, I think. We are able to let the doctors know that the patient's in their room because the doctors are located outside that area of the doctor's door. So we do let them know that the patient is in, and I think it helps things run much smoother as far as patients' care. Quickly getting in and out to see their doctor. And all of our patients so far love our new facility.
The Prairie North Health Center opened in April 2015. The design team agreed that the new clinic would embrace an interdisciplinary approach to patient care. What does that mean to the staff who work in the clinic?
My name's Deborah Gullickson. I am the counselor here at the Primary Healthcare Clinic located in the Prairie North Plaza in Lloydminster. The design of the clinic is set up so that the patients have easy access to the doctors have easy access to my services as well, which is usually done through notifying me through a task on the EMR system, or on several occasions I would have them call or just knock on my door when they have a patient in there that's distraught. and need immediate assistance.
We are all team here working for the patient's benefit. First we have the family physician, and then we have an registered nurse which is here to help us in education. We have an educators, we have a counselor, we have lab, we have clinical assistants, and all of us working together to get the whole benefit of the patient.
My name is Jennifer Workman. I'm the registered nurse in primary health care. We never know when a patient comes in what they come in for. They kind of surprise us. With me, like, they might need that education for their chronic disease, or they just been diagnosed with it. Sometimes it's with Debbie, the counselor, like they're having a really rough time and they need to see someone immediately. It makes that more accessible, and they don't have those wait times. And that if they go home, having that follow-up right away instead of, you know, having a referral and getting them to come back in, it's a lot easier this way, and they kind of get everything at once.
The clients that I work with, the feedback that I'm getting from them is that they appreciate having a counselor on staff here at primary health care. They don't have to go to another building or another facility to access that service. It is here. And the wait list to get in to see me is fairly quickly. I can get them in within days. When they get that call asking, you know, to schedule an appointment, and the feedback I get is that, wow, already so soon? This is what healthcare should be, and it is. That's what we deliver here.
I'm just so pleased. I had my doubts that, you know, the board or the people that were in charge wouldn't maybe look at it seriously enough, that, you know, the cost might be an issue, but they took everything that we put forward, because it does feel good to be able to tell your neighbor or your friends, like, oh, I was in on helping design this, you know. Some of my ideas were heard, and that they cared about what the patient wanted, not just the staff and the doctors or the designers or those one putting out the money. It was really what the patient wanted.